the Allah who cares me and who will cause me to die and then bring me to life again, and never stop knocking to Allah's door. If you know how your Lord deals with your affairs for you, your heart would break out of love for Him. As a result, I suffered 6 years of this illness and passed 6 surgeries with lots of problems and challenges, and spent lots of money for other doctors and hospitals, but never got a sufficient result, and I disappointed that never will obtain my health. Finally, God guided me to Dr. Ashish Banud. After long discussion with him, agreed to do another surgery by him. Because I already done 5 operations and not healed, because I was thinking that maybe I won't be healed of this illness. Fortunately, with his operation, God gave back my health, and I can say that Dr. Ashish Banod is one of those doctors that fulfill his responsibilities in job and all he can do, and I appreciate him of his job and surgeries that he did for me. And I ask Allah to increase Dr. Ashish Banut knowledge to find an easier way to this illness. I want to mention something about the illness of chronic fistula, that everyone got this kind of illness should be patient about that, because this is taking long time for illness, and this wouldn't be possible without a very good doctor to do it. And also the wants of Allah is important too.
This is a very complex illness. I also know I get so many patients which have such a complex disease that you cannot treat all of them. Some of them you can give good results, some you can improve the quality of life, and many of them you can cure 100%. But person who has coming, he should understand that disease he is coming with. It is not something which doctor has caused, but the disease comes in short time, it takes long time. Treatment, sometimes some of the disease, the treatment is very long. Some persons, they heal within 2-3 weeks, 6 weeks. I think how much time you had taken for the recovery?
As I experienced this was very not as I was thinking at the first time. I was thinking this is very simple disease, and it will be healed after one surgery, but it never happened like that, because this is a very complicated and contaminated place, and everyone thinking that this is very easy to be healed after one surgery, but no, it is not like that. Because I did 5 surgeries in other hospitals, even in India and out of India, and I never healed this illness, because I had for example, I had no experiences about that, how to take care of that, how to take care of
You must be feeling very much annoyed also with your doctors, that why it is coming again, what has happened, what was the cure not taken, or maybe you must be frustrated about what's going on.
I was asking every time. I was asking many questions about this. Many questions about that. Why? And I am spending money. I'm coming here, wasting my time, and giving a good price for the surgeries. Why it is giving me a sufficient result for this? But the doctors telling me all the time that this is taking time. It's taking time. But when you did the surgery, it was completely different, because I the first at the beginning of the operation, I feel the changes that you did, because you did the surgery by VAAFT, and it was hardly I satisfied, because maybe because I will get the result, because if we do it by VAAFT, it is, you can find every corner, every place there is contamination and affected by the disease. So that is why when I did the surgery, and after one day I could walk, I could go everywhere, and there was no problem with me, no pain. But this is very simple, and that every illness is need a time, a period of time should be taken for.
After how much time this VAAFT surgery, your this fistula healed?
It was something like usual things, something like 1.5 months after the complete healing of the wound, and after complete healing of the area. And I was the medicine which were given to me was very I was satisfied with that, because it was the right medicine which I have to take for this illness. Because if you take different type of the antibiotics, it doesn't affect. If you give the right ones, which is effect on this kind of microbe or germs, so it will give a good result for them.
Definitely. And with the help of, I am doing almost all techniques. Where small fistulas are there, we cut them out, take them out. Where there are deep fistulas, we cannot reach out directly to that area. We need to do a lot of cutting to reach that area. And doing that cutting is very painful for the persons, and that are very big wounds. Sometimes patients can get perianal sepsis. If they don't do follow-up proper dressings, there can be problems.
Exactly, because this is why I didn't got healed before 5 surgeries. Because the doctors, when I did the MRI scan for this illness, and the doctors told me that there is a horse position of the pass.
Horseshoe-shaped
fistula. Horseshoe position. So that I was really disappointed, because the doctor told me if I cut this place, it will remain the other side. If I cut this place, there will remain the other point. So I was thinking, and they also suggest me that I have to do another colonoscopy. What is this kind of
colostomy?
Colostomy surgery. I said to the doctor, if I do this, I'm gone, because this is not a very easy word that you say. You do the colostomy.
The colostomy is basically making a hole for the stool and the abdomen.
Yes,
you will be passing it
from the bottom, and is making a hole in the side. So I said I never satisfied of that, because this was taking time for me to go and come to India, and that is why I never give up, and I did my searches of another doctor. As I mentioned, God guided me to.
I even get patient for Crohn's disease. His fistulas were much worse than yours. We did, and he was advised colostomy everywhere. There was no other option. But the young child, almost 21-22 years, he was not willing for colostomy at any cost. We did this VAAFT surgery, complete clearance of fistulas. 2 big holes were there, 2 big fistulas, and patient was passing stool through them. And continuous stool was coming to the fistula, and fistula had reached up to the root of the scrotum. Just below the testis, that was the opening. And through that opening, stool was coming. But because of Crohn's, whatever efforts, whatever things, we did a VAAFT surgery. We did the surgery 2 times for him, and he's now completely healed.
So, yeah, that is why, sir, I'm really satisfied, and I don't have any word to mention of satisfaction of your operation, your surgery, and your knowledge, your fulfilling of your all jobs and your kindness, everything. But as I'm thinking, the doctor is a very close person to the patient, even from his parents, even from his wife and kids and children, because the patient can share any kind of issues about his illnesses and diseases of which he has. But right now, I'm even I would say I want to say something that even I was sitting in a car, I was suffering of too much pain. But now when I'm sitting in a car, I'm really enjoying, and from heart I'm making dua for the Dr. Ashish Banot. Because that was really I was suffering. My family was even suffered a lot of this, because everybody was thinking about me, that how kind of this illness. And maybe they were thinking. My parents told me that maybe this is cancer. As I said, no, this is not cancer. I discussed with the doctors. This is not a cancer, but worse than a cancer, and this will take too long. But see, this is the God examinations according to the slaves. So we have to be patient.
Many times patients come to us that they believe they have come to the doctor, especially for fistula problem. All other diseases can definitely be cured. Most of them are to the extent of 95%, most of them to the extent of 100%. But fistula is something we do our best, and still we cannot expect 100% cure.
Yeah, that is why, sir. And from every surgery I was doing, I was just patient for Allah, for God, because
it's your patience which paid you.
Yeah.
If you were impatient, probably you would have lost faith, and you would have never got cured.
Yeah. Because the doctor is the doer, just a doer of the surgery and the operation, and he is also trying his best. Not is that he did wasting the time or earning money. Just he is doing his best to the patient get healed and obtain his health again. But every patient, if they have this kind of illness, they should be patient, and this is not of 1 or 2 months discussion or story. They have to be patient for 1 or 2 years, maybe 4, maybe 5. As I suffered of this illness for 6 years, and I did 6 surgery. Even I did the surgeries every 2 months, every 3 months from each other. So,
and you kept your faith, and your faith in the God that has helped.
Yeah, definitely, because this is the examinations of Allah, that they examining the slaves, who is patient, who is not, who is thinking that everything is from Allah, from His side. So the doctor is, I can't say any word to say thank you from Dr. Ashish Banot, that Allah guide me to him, and I'm really happy, and I'm now I'm coming all the time with him and meeting with him as a friend.